Okay, today, Ms. Rogers, we are going to be removing that Foley catheter. You've had it in for 2 days, and you've done so well after surgery that the doctor's written an order for us to take that catheter out. And to take out the catheter, we're going to need several supplies. We're going to need a pair of clean gloves. We're going to need a syringe, and then either a tissue or towel or something when we go to take it out. So what I'm going to do, Ms. Rogers, this will be very quick. And what I'm going to do is I'm going to fold your covers back, and before we take the catheter out, I'm going to go ahead and I'm going to empty the Foley bag and put the amount on my output record, because once I get this catheter out, I would prefer just throwing the whole thing away without having to worry about now going to the bathroom and empty the bag. So I've emptied the bag, and I'm going to lay that right there on the side of the bed. And I'm going to go ahead and I'm going to loosen up this tape. It says remove with alcohol. So I'm going to remove the securement device. Okay. And it really sticks. Okay. Then I'm going to put on my clean gloves. And I'm going to attach my syringe to the inflation port. And normally the water will come back immediately, but I like to give it a little pull, because you will feel when the flow stops and you meet that resistance. I know that my balloon is deflated at that point in time. Then I like taking a paper towel or a tissue and holding it up underneath the patient. You could also put a Chuck's pad, a washcloth or something underneath. In a female patient, it usually just falls out. With a male patient, of course, the urethra is longer, so it will take about 6 inches. So I'm going to pull it out. And I like having my towel here, because with that bright white backdrop, I can examine the end of the catheter. I can look and see if there's any pus or blood. I can look and see if that balloon is still intact, because we want to make sure that's intact. And then I can wrap this up. I can pull my glove over it. And then I can just discard all of this in the waste basket. Okay. Then I would want to put on a new pair of clean gloves and come in and provide perineal care. After we remove the catheter, you need to make sure that you tell your patient, Ms. Rogers, now that this catheter is out, we need to make sure that you will be able to empty your bladder on your own. So in order to do that, I need to bring you something to drink so you can start getting some fluids to make urine. So what would you like? Ginger ale? Okay, I'll be glad to bring you some ginger ale. The first time you void after the catheter is out, it may burn a little bit. There may be even a tiny bit of blood in it, and that is perfectly normal and will go away. But please let me know when you do need to use the restroom so I can look at it and make sure that you're emptying your bladder adequately. Do you have any other questions? No, ma'am, that wasn't so bad at all, was it? Okay, well, let me get your covers pulled back up. And I'm going to put your bed in low position, and you call me if you need anything.